Is TB prevention possible after exposure to the bacteria? This question is crucial for anyone who may have come into contact with tuberculosis bacteria. The good news is that tuberculosis prevention after exposure is indeed possible. When someone is exposed to Mycobacterium tuberculosis, the bacteria responsible for tuberculosis, they might develop either latent tuberculosis infection or active tuberculosis disease. Latent tuberculosis means the bacteria are in the body but inactive. This stage does not cause symptoms and is not contagious. Preventing the progression from latent infection to active disease is a key focus of tuberculosis prevention efforts. So, what can be done after exposure? First, testing and diagnosis are essential. If you know you have been exposed, it is important to get tested to see if you have a latent tuberculosis infection. Common tests include the tuberculin skin test and interferon gamma releases assays, such as the quantiferon gold blood test. Identifying latent infections early allows for preventive treatment to stop the progression to active disease. Next, if you are diagnosed with latent tuberculosis infection, you can receive preventive treatment. This usually involves taking antibiotics for several months. This treatment significantly reduces the risk of developing active tuberculosis disease. Studies show that about 9 out of 10 people with latent tuberculosis infection can avoid progressing to active tuberculosis with proper treatment. It is also important to manage risk factors. Certain conditions can increase the likelihood of latent tuberculosis progressing to active disease. These include weakened immune systems due to conditions like HIV/AIDS, diabetes, or cancer. Monitoring and managing these underlying conditions is crucial in tuberculosis prevention. Vaccination is another aspect to consider. The Bacillus calmette-guerin vaccine offers some protection against severe forms of tuberculosis in children but is not fully effective for adults. It is mainly used in countries with high rates of tuberculosis and should not replace testing and preventive treatment after exposure. Public health measures play a vital role as well. Investigating contacts and screening individuals exposed to active tuberculosis cases help identify latent infections early. Educating communities about tuberculosis transmission and prevention is also essential. In summary, while exposure to tuberculosis bacteria can be concerning, preventing active tuberculosis disease after exposure is achievable through testing, preventive treatment, and managing risk factors. These strategies align with global health guidelines and can significantly reduce tuberculosis incidence and transmission. Always consult a healthcare professional for personalized medical advice and follow prescribed treatment plans for effective tuberculosis prevention after exposure.